So turning now to our June update of the modeling and data that we've been using to manage our COVID response. The first slide we'll present is the geographic distribution. This is by local health area to be consistent with the presentations that we've been giving monthly since March of last year. And it does show, this is cumulative, so it shows that there have been no areas of the province that have not been affected by COVID-19, but some areas certainly have been affected more than others, and particularly in the lower mainland. But we also see that in some of our more rural areas in the north, particularly the northeast, have been highly impacted. The good news is this is the information about cases and case rates in the last week. And happily, we see that in most areas of the province, there have been little to no cases in many, many communities. There continues to be transmission in the lower mainland and a few hotspots, including in the Peace region in the north and also in the Grand Forks area in the south. And in some of those smaller communities, the case rates can be quite high, even though the numbers are small. But this reminds us that there still can be transmission if we're not careful. But it does also reflect the fact that as many more people are protected through immunization, our risk of transmission and the risk of the virus in our communities is going down dramatically. These are the dot plots that we've been using to help identify hotspots in communities around the province, and we can see that there are still high areas in high case counts in some areas, including Surrey being at the top in the province. However, the good news is that this has dramatically decreased by over 50% in the last 2 weeks. So that is a testament to people doing what they need to do and the immunization that is happening in those communities across the province. When we look at case rates, we see that areas like Grand Forks, where it is a very small population, have a higher rate of transmission. But again, the positive that we see in this is that most of the rates have dropped quite dramatically in the last few weeks. This is our overall epidemiologic curve that has our cases at the top, and the middle line is hospitalizations, and along the bottom, the number of people who have died from COVID-19 over time. And what we can see quite happily is starting in the middle of April, we have a dramatic drop in cases overall, and shortly thereafter, we started to see a decrease in hospitalizations that continues. One of the things that we note on this, and it reflects again the power of the immunization programs that we have, is that deaths have remained low throughout the third wave, despite having the highest number of people infected in the whole of our pandemic here in BC. And that reflects our program, our immunization program that was targeted at protecting those most at risk, particularly our seniors and elders in the community and in long-term care. And it really reflects how immunization has changed the landscape of this pandemic. And we can see that this is reflected across the province. Although the pandemic has been experienced slightly differently in different health areas of our province. We know that Vancouver Coastal and Fraser, where the majority of the cases and the highest case rates have been, have had a similar bimodal pandemic, but in the interior and particularly in the north, there has been consistently higher rates over an extended period of time, even though the numbers are smaller. But thankfully, we've seen a dramatic decrease in both areas in the last few weeks, and again, reflecting the power of the vaccines that we have right now and the measures that we're taking to reduce transmission in our own communities, in our own social networks. We also see the change over time by age, and we've seen in all age groups in the last few weeks we've had dramatic decreases, and it's gone sequentially as different age groups have been eligible for immunization. One of the things that we can note here is the purple line, which is people 80 and above, and again it stayed low and steady during the third wave, reflecting the power of the vaccines that we have to protect people individually after even a single dose. Finally, looking around the province, this is our daily case rates and the percent positive of cases that we've had up until the end of last week. And in all cases, we're seeing, again, a decrease not only in numbers of people testing positive, but across the board, decreases in percent positivity, despite having high testing rates. This is a reflection of the more serious illness that we're seeing, and it's still hospitalizations on the left and the number of people who have died on the right. And it does show the picture that this virus does have most serious effects in people who are older, particularly people who are in their 60 to 79 or over 80 age group. Here's an updated review of the data looking at the distribution of cases, hospitalizations, ICU admissions, and deaths by age compared to the percent of that age group in our population. And we still have very few cases and very few serious cases in young people, particularly people under the age of 10. We have sadly had 2 people who have died, one a toddler and the other an infant under the age of 10. We've had no deaths and very few hospitalizations in school-age children from 10 to 19, and we know that the risk goes up of having severe illness, having hospitalization, and sadly death as age increases. We have been paying particular attention to school-age children, so 5 to 18 years in BC, and overall the numbers of cases remain low in this age group. Hospitalization is 10 times lower in school-age children compared to adults, and for the most part, it is less than the percent of the population. So thankfully, young children in particular are underrepresented in illness with COVID. Some of the things that are important for us to watch over time is what strains of the virus are circulating in our community and how many of them are what what has been called variants of concern, because they may increase transmissibility. In most of them at this point have increased ability to transmit between people, making it that much more challenging to stop transmission and stop outbreaks. So this is a reflection of the epidemic in the different parts of the province and in British Columbia overall. And what we can see is that the variants of concern that have been identified are now the predominant strains that are circulating in people and being transmitted across the province. Even though the numbers are very small in some places, even in Vancouver Coastal, where it's as high as 100% of them are variants of concern, the same measures that we are taking to prevent transmission of any of the strains of the virus are working to prevent transmission and to reduce the numbers of people with this infection in communities across the province. I will say that we have adapted our testing strategy, as we've talked about a number of times. We were using a screening test, but that has limitations, and it can't detect every single variant or every different strain of the virus that is circulating in the province. And as we get smaller and smaller case numbers, and as we start to open up more and people are traveling more, it is more and more important that we know exactly which strains of which virus are circulating where. And to that end, we've now moved, as of a couple of weeks ago, to doing a whole genome sequencing on 100% of our cases in British Columbia. So what we know exactly which strains are infecting people across the province, and we have the capacity in our lab to do that. We've done close to 33,000 whole genome sequences since the pandemic began, and it has helped us in understanding how outbreaks have been transmitted, whether there's variants that are causing clusters or outbreaks in workplaces, in long-term care. And now every single case, we are able to determine exactly what strain is circulating. And this is a summary of the relative proportion of just the variants of concern that have been identified by the WHO that are in our province over time, with the bar on the far right being the week of May 3rd to June 5th. And we can see that the predominant strains that we're seeing circulating are the what's now called alpha and beta strains. The delta. The WHO is supposed to make this easier by switching to Greek names, but it's the alpha and gamma that we have most commonly here in British Columbia. So the P1 and the B1.17. And we have seen some geographic variation with the B1.17 seen more commonly in Fraser Health and P1 in Vancouver Coastal, but all of those are coming down. This is the proportion of the strains that we're seeing. The beta, the one that was originated in South Africa, we did see some of that circulating in BC, but that has mostly been contained and controlled by the measures that we took to prevent transmission, and of course by protection from immunization. Right now, we are seeing some transmission with people infected with the Delta strain, but it is a small number and a small proportion of the cases that we're seeing on a daily basis. And on the BC CDC website, you can look in detail at all of the different strains that we're seeing circulating in BC. There's about 14 other additional strains that we're watching and monitoring with whole genome sequencing, ones that have mutations that we want to be able to understand if they're being transmitted in the province, and it includes strains that were identified in New York, California, in Brazil, etc. So this is going to be more and more important for us as our case numbers decrease and as we have more people moving around the country, the province, and eventually internationally. To understand exactly which viruses are being transmitted between people is how we detect whether a new strain that might have some other advantage, whether that means vaccine doesn't work as well, or if it transmits more easily or causes some more severe illness. So this is an important role that the BC CDC will be doing and has been doing in BC, and will be linking with whole genome sequencing from across the country. I know there has been some concerns that we're not detecting all of the strains that are circulating, and that things like the Delta strain could be accelerating, and we're not able to detect it here in BC. With the strategy that we have for testing, and with our lab being able to have the capacity to do whole genome sequencing rapidly on all cases, means that we are in a good place to monitor this carefully over time. So finally, to go on to the other important part of our program, our vaccination progress, and this is the dashboard summary in one slide. Up on the right, the dial indicates the proportion of people with first doses, which as of yesterday was only 72%. As I mentioned, it's up to 74.9 today, and our second doses is up a little bit above 8% now. What we call a population pyramid on the left-hand side gives you an idea of the size of each age cohort and the number of people or the proportion of people who've been immunized with the blue being first dose and the green being second dose. As we can see, that is increasing, starting with our older age groups and moving down through to 12 to 17-year-olds, now having a good start on getting up with first doses. We also see that it's not equal across the province, and certainly in some areas in Northern Health and in Interior Health, we're having more challenges in reaching people, and we're taking different strategies to make sure that people have access to vaccine across the province. This is another summary which shows the trajectory of how people the progress in immunization percentage by age across the province. And what we can see is as people became eligible in that age group, we had increased rates of immunization, and then it leveled off somewhere around 80%. One of the things that we are seeing is in the younger cohorts, that leveling off is happening a little bit earlier. So we're doing more targeting towards younger people to make sure that they are getting immunized, especially with first doses in the younger cohort. And then at the very end, the 12 plus is the summary of how we're doing with immunization across the board in the province. And to put that into a context geographically, this gives a sense of the vaccine coverage by local health area for people 12 and above. And I will note the lightest color green is above 50%. So everywhere in the province, we've reached 50% coverage for people 12 and above. But in some areas, that is much higher. And the highest, the darkest green, is 80%. And it's really great to see that in many areas of the province, we've reached 70 to 80% in coverage in people 12 and above. And if we look at this same information for people age 50 and above, even more areas of the province are covered. But this does tell us there are some pockets where there's still more work to be done, both to encourage people to be immunized and to make sure they have access to vaccines, particularly in the Northeast, in some parts of the central Okanagan and the Grand Forks, Kettle Valley area, and of course in some parts of the Lower Mainland, particularly in Richmond area. So given where we are with our case rates, where we're seeing by age and by geography and where our immunization program is going, we now are able to look at our modeling and to understand the trajectory of where we're going right now. So this is our reproductive rate over time, and it really shows that for the first time in many, many months, we are trending downwards. We're below 1, which means that on average, people are transmitting the virus to less than 1 people every time somebody's infected. And this is across the board for the first time in many, many weeks. If you remember the last time we presented in end of April, early May, we were actually on a trajectory above 1 and heading up. And this is really great news, and it means that people have been paying attention. It means the immunization is making a difference, and the measures that we've been taking together have meant that transmission has gone down. We've been protecting our family, our communities across the board.